So you came from Colorado to have this procedure. Tell me why you came so far for.
Well, as you know, my son had the procedure, and he and I think, have similar facial structures, and we both had chronic sinus infections. And he told me that after the procedure, he's never A, felt better, and B, has not had any sinus problems for an entire year. And typically he and I would have as many as 2 and sometimes 3 sinus infections per year. And I mean, I'm not exaggerating when I say debilitating.
Mm-hmm.
I mean really almost like chronic fatigue syndrome.
Okay.
And so I know that he worked with you, he recommended it, and he saw me in March and April of this year and said, "You've got to see Dr. Armstrong because you're not typical of the way you normally are when you're healthy." Speaking about me,
right.
So that's
okay.
how I got here.
Well, I've injected a little bit of local anesthetic under your lip and inside your nose, and what we're going to do is the FinESS procedure, which is to
right.
do a balloon dilation of the maxillary sinuses through a small puncture under the lip. You ready to start?
Right.
All right, go ahead and set your head back here and just relax. And you'll feel a little firm pressure right up in here for a second. And once that goes through there, I'm going to take this out. We're going to put the camera in. And we look up until we see the natural opening, and we can actually see the mucus going in the out one opening and back in the other. So I'm going to take the balloon now. I'm going to insert this through the opening. That's a perforation down low that gets clogged, but up high is the preferred opening or natural opening to the sinus. We're going to put the balloon in there, give it a little twist so we can keep it in view, and go ahead and inflate. You'll feel a little crunch as we inflate it.
Inflate it?
It slipped back. Deflate again. And we'll work it back in there. Okay, go ahead and inflate one more time.
Inflate
There
it?
we go. And deflate. And when that's done, I'll just wipe the lens and take another look and see what we've done. And then that opening is quite a bit bigger, right into the nose. Okay, that's one side done. How was that?
Okay.
That side's done.
Yeah, that's good.
Was that easy? Did it hurt? Okay.
No, you did a great job.
Ready to do the other side? There we go.
Okay.
And there's the opening. Not the first one, okay. That's not better. Deflate. Okay. All right. And we're all done.
That was fast.
Yeah, the second side was a little more challenging than the first, but first side was real easy.
No,
Was it painful?
I'm sorry.
Was it painful?
No, no,
Did it hurt at all?
no.
Okay.
I just, like you said, I felt some pressure, but I felt no pain at all. 0. Like on a
That's-
scale of 0 to 10, 0.
That's great. That's great.
He
Took
did a
about.
great job anesthetizing me.
Mm-hmm.
I think that's the key.
And well, it's been perhaps 1 minute since the procedure. It took about 1 minute to do the left side and maybe 5 minutes to do the right side, and it's immediately afterwards. Do you feel like you could
Yeah.
go out and play golf or do what you want to do today?
It's pretty much what my son said. He said it was similar to a dental procedure, and he said, you know, he kind of set me up for it. He told me what to expect, and that's pretty much exactly what it was. I've had much more pain at dentists.